Oh. Hi. Hi.
How about that one?
Hi, I'm Bob Schrupp, physical therapist.
Brad Annie, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, of course.
Right. Brad, today we're going to talk about patellar tendonitis and what I think is the best treatment for it. This is really a cool trick. I think if you try it, you're going to be really pleased with it. Patellar tendonitis is when you're getting that pain, I guess I can roll mine up too, right below the kneecap, right on that band there.
Right.
I think this works really well to show it. This would be the knee right here, like that.
Except for
like that.
this model, the tendon popped off.
Popped off, yeah.
It looks like this.
So you got the kneecap, and then you got the band, little tough fibrous band that helps hold that kneecap down to the tibia.
It's actually part of the tendon for the quadriceps.
Yep.
We're not going to get into that. We're just going to talk about that particular tissue right
Now
there.
this is not, we're not talking about Osgood-Schlatters disease, which is a whole different thing, and that's the inflammation of this bone here, and maybe even a little bit of separation on that bone.
Sure.
This is the actual tendon itself is giving you trouble. And what we're going to be doing, Nancy, can you see this? We're going to be rubbing across this tendon, right across it, because what has often happened is this tendon has thickened, or it's maybe got some tears in it, or it's just a little bit inflamed. Now, when you're doing this rubbing, you're going to be rubbing across here. If it just gets worse and worse as you rub, you're going to probably want to ice first.
Right.
You're going to put an ice pack on it, or maybe do an ice massage to it, which we've had videos on that before. So, all right, let's go right through this, Brad. Let's do first. I'm going to have you lay down or sit up and with the leg out straight. Yeah. There you go. Perfect. Okay. What we're trying to do here is we're going to tip the kneecap up a little bit. So I'm on the top part of the patella or the top part of the kneecap. Now you can do that one of two ways. I've seen people go kind of just like this and hold it up like this. And then usually, I like to use the long finger. Some people use the ring finger. Either way, you're supporting one finger with the other finger. So you're going to go like this, and this holds it up. The other way to do it is just to take your whole thenar eminence here, I guess.
The web between the pointer finger and the thumb.
The web, yeah. And you can push the kneecap this way a little bit, and it's also help holding it up. And you're going to take your finger, you're going to rub across it like this. You got that, Nancy? Good. Now, I'm not just rubbing the skin. I'm getting in there deep, aren't I, Brad?
Yeah, it's getting in there.
Now, the patellar tendon even actually attaches up to the sides here. You can even work on the sides a little bit here. I'm going across the fibers. Again, I would start right here. And now you can expect some tenderness, but after a while, 20, 30, 40, 50 seconds,
right,
it should start to maybe get numb or actually feel better. If it doesn't, then it may be too tender, then you may want to ice.
Ice and then do it, or just ice and leave it go for a day?
I would say ice and then leave it go, and then maybe try it the next day again.
Mm-hmm. What kind of symptoms are going to be present that are indicate?
You're going to have pain. You're going to have a lot of times people call this jumper's knee. A lot of times they'll get pain after they've been doing a jumping activity, high jump or basketball. It's just really pain is the biggest indicator.
Specific to that area.
Specific to that area, exactly.
Right.
So you can do this. You can go up to 5 minutes. You can even do 10 minutes if they tolerate. Most people, it's going to be about 5 minutes that you can do this, and you can do it every day.
Sure. If the response is positive, and I could do this to myself, then, right?
I think you could. I think you could push like that.
Yeah.
And then
get in there
and put one finger over the top of the other.
Yeah, I like using that middle finger and then support
I
here.
bet you do like using that middle finger, don't you, Brad?
Bob. Why, Bob? All right, so I'm going to work in there like that. There we go. Actually, doing it to yourself, you can, because you know where you're.
Yeah, you can work it where you need to work it.
Right.
I think it's a fantastic thing to try to do yourself.
Sure.
Absolutely. Why not?
Mm-hmm.
Really no harm that can be done with this.
Right. Again, did we mention this is that cross fiber?
Cross fiber friction.
The fibers go this way,
yeah.
And we're going opposite 90
All right,
degrees.
let's go into another bonus treatment here that you can do, Brad. Why don't you just go right on over the edge here. Sit up on the edge. A little probably more difficult to do on your own, but you could. What you're going to do now is you're going to actually pull your arm right underneath the kneecap again. The kneecap is right here. I'm going to pull down the skin a little bit this way towards the foot.
So he's actually pushing.
All right, I'm sorry. I'm going to go this way. I'm sorry. I'm going to push up.
Can you do it with the other hand so they can see it better?
This right here?
Yeah.
Okay.
So
I'm sorry. I was going the wrong direction. I'm going to tap and push up. and now I'm holding that, and then while I'm doing that, I'm going to bend the knee.
So you're essentially stretching.
I'm stretching that tendon. Because what often happens is you got a thickening of that tendon, or the tendon is tight, and because it's tight, it's pulling, and that's what's irritating it when you do use it in activities. So again, place the thumb below the patella, below the kneecap, push in, and then push up, and then hold it, and then bend the knee.
And he's pushing fairly good.
Yeah, I'm pushing hard.
And it doesn't bother me at all.
I would do a good 10 of these.
Mm-hmm.
On someone that is having trouble or tightness, they're probably going to feel this.
Yeah.
I did this to myself last night. Want to try it yourself, Brad?
Yeah.
Because you could do it, you could tack it like this and then bend it back yourself. By
I could use my other
You
leg
could use your other leg.
for a passive.
Yep.
Would that be better, or actively do it?
Either way is fine, actually.
Okay.
Because sometimes when you activate the hamstrings, the quad relaxes
Sure.
automatically.
Yep. Yep.
So that would be a good way of doing it.
And I could really get a good lock on there if it wasn't too tender. And I'm bumping up against the table here, but.
As a final thing, just as a final bonus, you can go ahead and actually stretch that leg then too. You can finish by grabbing onto a chair and grabbing. I can do it this way.
Sure.
You may have to work up to that.
You could lay down
Yeah.
grab here. That's just a little aggressive, but
Yeah.
feels kind of good right now.
And that's going to stretch that tendon and the quadricep out too.
Oh yeah. That was the double bonus. All right.
By the way, Brad, we can fix just about anything, but we can't fix a broken heart. This was made by my daughter. This is folded book art. If you're interested, go to happylittlegifts.com. happylittlegifts.com, and you can buy these.
Cool. This is good therapy in itself. You can make that. And I want her to make one and give it to my wife next time.
I was going to say, my son made one for his girlfriend.
Oh, really?
Yeah.
Wow.
Yeah.
He's a very sensitive man.
Oh. Yeah, he's sensitive, all right. See you later.
Take care.
He actually does.